Welcome everyone to the Fibromyalgia Impact Tour. We're excited to be here. We are in Portland, Oregon, visiting with Kelli from More Than Lupus. If you're out there watching now, please leave a comment and let us know where you're tuning in from. Like, share, and just engage in this conversation. Get ready because we have a special, inspiring conversation with Kelli. We have some giveaways coming up. Hello from Chicago. We're excited to see you. And also, if you've gone to Portland and you have favorite spots, we definitely please share your comments, but let us know where you're tuning in from. We are joined with our special touring guests, Looms for Lupus. So we're going to do some quick introductions and then get started with our show. So I'm Melissa Talwar from the Support Fibromyalgia Network, and I wanted to introduce our special co-headliners for the Fibromyalgia Impact Tour from Looms for Lupus, Estella and Juana.
Hi, good morning, everyone. I am Estella Mata. I'm one of the Mata sisters and co-founders of Looms for Lupus, a nonprofit organization that was formed by my sisters and I to support those living with lupus and overlapping conditions such as fibromyalgia. And we're excited to be here today.
Good morning, everyone. I'm Juana Mata. I am the other co-founder of Looms for Lupus, and I was diagnosed with lupus in 2009.
And Kelli, please introduce yourself to our audience.
Hi, everyone. Thanks for having me. Welcome to Portland. I'm excited to be here today. My name is Kelli Roseta, and I have been living with systemic lupus since the age of 11. So over 30 years now, I have been living with multiple organ involvement and blood issues, multiple skeletal complications, and have been hospitalized dozens of times.
Well, we welcome Kelli as our guest, and we're excited. We wish we could be there in person visiting Portland. I love the area so much, and there's so many amazing people there. Just to share with everyone watching today, the Fibromyalgia Impact Tour is part of the Health eVoices Impact Fund, and this first leg of the tour, we're introducing you to some amazing advocates around the country that are making an impact in your very own community. So we are fortunate to be able to highlight so many amazing people. And some of the next legs coming up, we're going to be talking about functional medicine. We're going to be talking about organic gardening, food insecurity, how to eat healthy nutrition, some movement, and a whole lot more. So please stay posted, like and share with friends. And again, tell us where you're tuning in from. Let's get it started and keep talking to Kelli. I need more coffee, people. Portland's full of coffee. Why am I not getting more coffee?
And Melissa, let's let everyone know that they have to be paying close attention because we are going to be giving a giveaway or several giveaways today. So please focus, pay attention, take notes of all the amazing information that Kelli Roseta is sharing with you because you can win a couple of those giveaways.
Yes, we have a giveaway coming up, and we will let you know when and what the question is so you can answer and win those giveaways. Okay, Kelli, so you are definitely making an impact. I know many of us work with you on different occasions, and we are watching your great educational webinars, your support groups, and I've seen you at Capitol Hill. But let's start from the beginning. What inspired you to start More Than Lupus?
Well, as I mentioned a little bit ago, I've been living with lupus since the age of 11. And in my adult years, after attending a lupus support group, this is how it all got started. Okay, taking you back. After attending a lupus support group, I realized what a need there was for lupus patients to know that they are not alone, because we often feel like we're all alone. So I started really listening to the patient's needs, and I realized what parallels and similarities I found in their stories. And I also noted the pitfalls in our medical institutions that made it difficult to access care and the alarming lack of funding and awareness that lupus seemed to generate. And, I would log on to different websites that were not patient-driven, and they felt really cold and they felt really clinical. So after working with some various nonprofits in Portland, and by the way, I just want to stop and give a huge shout out to Miss Molly McCabe, because she really inspired me and encouraged me along my journey to form my nonprofit. I formed More Than Lupus. as a place for those in the lupus community to feel supported, whether they were newly diagnosed with lupus or a lupus overlap illness, or if they've been living with lupus for decades. You know, a place for patients that understood the needs of the community, a place where patients would be driving the content and that they would be the center of everything that we do. Because my focus has always been, and I hope always will be, to give those living with lupus a voice in a world where many still don't know what lupus is. 2/3 of Americans know little to nothing about lupus, nor do they take it seriously. So it's named More Than Lupus. This is kind of fun. I always like telling people why I call it More Than Lupus. It's named More Than Lupus, and there's a tiny little period at the end as well. It's More Than Lupus, period. Because that is exactly what we are. We are so much more than a sum of everything that is wrong with us. We are more than lupus. Yes, it's a part of us, but it's woven into the tapestry of our life. It's not all that we are. And it's important for us to always remember that. We are more than lupus, period.
I love that. And I'm glad you brought it up and highlighted the more than lupus and just how much we can still thrive despite our diagnosis. And that's what we love about all your work, all the positivity you bring, and the education you bring as well. I know you work quite a bit with Stella and Juana, and when it comes to support group services. Can you tell us more about some of those support groups and what goes on, like when they are as well?
Sure, my pleasure. You know, living with lupus is hard, and it's important to find a community where you don't have to pretend that you're okay, that you can be real and authentic. So we offer multiple opportunities of support groups where you can be your open and authentic and real selves and talk about what I like to call the peaks and valleys, highs and lows of your lupus journey. So our monthly lupus support group, it was in person, now it's Zoom, obviously, meets the third Saturday of the month, every month. And it's open to all people who are interested in joining. And then there are the lupus Facebook lives that we do every Monday on the More Than Lupus Facebook page at 10 a.m. Pacific Standard Time. Now, this, to be honest, is really what got me started. This is what put More Than Lupus on the map. This is how Estella and Juana found me, and many other people, patient leaders in different disease communities found me, because I essentially made a format where I would present lupus information, you know, news, research, the latest things happening at More Than Lupus, and then give some inspiration for daily living. And then the rest of the time during this hour would be dedicated to reading and answering people's comments, questions, concerns, all the things you really want to ask and want to know and troubleshoot and get opinions on. And this was there in this forum. So this is really cool because this is something that a lot of people have taken note of and have gone on to form their own version, which is awesome. And somehow, even though I'm talking to my camera, this tiny little dot on top of my computer or my device, they are real, they are emotional, they are spiritual, they are in-depth moments that happen during these lupus lives. It's life-changing to a lot of people to finally connect on a level that they just didn't know they could. Sometimes they are silly. Sometimes they're like church. Sometimes I rant and I rave because I am living with active systemic lupus and I'm in the trenches. But no matter how they are that day, they're always real. And I think that's why they've been so successful. I mean, some of them have been viewed 15,000 times and 10,000 times. And like, it's crazy. It's absolutely crazy. It blows my mind.
And Kelli, you know, we thank you for that, because you're not only helping the new people that are being diagnosed, the caregivers, family members, but you're also helping us. And I'm not saying that I know a lot about lupus, but the little that I know, and with the information that you still bring us every time, you know, you have one of those sessions or those meetings, lives, I learned something from you. So it's not only helping those who are newly diagnosed, those who are newly coming to your support through Facebook Live, but all of us too. Every time it's just amazing, and how you reach and how you talk and how it really, it feels like real, like you're saying. So we thank you for that.
Thank you.
Yeah, I mean, we definitely encourage, and it's great to be surrounded by people that are supporting the community so well. I mean, with Looms for Lupus having their support group and being on. And one of the conversations we have quite often is, you have these supportive services. Is there anything that we can do to better, I guess, is there a better word, support those things, those initiatives and programs that you're working on? But are there things that you've noticed that we're missing maybe, or that need some extra support? And I open up this to everyone. So we'll have Kelli answer first of what she's noticed and how we can improve our communities, and then open it up for Looms for Lupus as well.
Absolutely. That's a great question, Melissa. One of my mottos is see the need, fill the need. And I think that's definitely presented in the work we are doing to shine a light on how lupus affects minority communities. 2/3 of those that live with lupus are women of color, with more severe outcomes and higher rates of mortality. Yet, unfortunately, they're the most underrepresented and underserved populations. And I've teamed up with Looms for Lupus, Estella and Juana, and GSK to host a continual plan to address these biases, racism in our medical institutions, and challenges with access to care, and barriers with enlisting people of color in clinical trials as well. And it all started last year by featuring trusted community leaders at our first event, how lupus affects African American communities. And then we had another session a few months later entitled How Lupus Affects Asian American Communities. And then we ended our summer session with how lupus affects Hispanic and Latinx communities. But we knew last year that this would not be a one and done situation. We were committing to a continual plan of action. So now here we are a year later, almost exactly, and we're having the same event, this time virtual, obviously, featuring incredible speakers and community leaders. And that's happening actually tomorrow on the More Than Lupus Facebook page at 3 p.m. Pacific time, so 6 p.m. Eastern time. And this event will feature Dr. Edith Williams, who will be speaking on improving clinical trial participation in BIPOC communities and addressing health disparities and racism in our medical institutions. We have Dr. Jillian Rose, who will be talking about how lupus affects BIPOC communities uniquely, both physically and emotionally, socioeconomically. And then we will have author and social activist, Miss Allie Henney, and with her background in psychology and studies on race, she's going to be addressing and giving her important perspective on medical gaslighting. So we really hope that everyone joins us, because this is important work, and this is work that we're dedicated to doing. And we're also very dedicated to coming alongside community leaders who have already been doing incredible work and highlighting, bringing awareness to the work that they have been doing for years now. So it's important for us to remember that we're not starting anything new here. We're really just drawing attention to the work that's being done and shining a light on the discrimination and the racial practices that have always been in existence.
Yes, and I totally agree with everything that you have said, Kelli. There have been so many biases and racial issues in the past, and I think it was needed. And I'm so grateful that we took that leap of faith and we both, started our own nonprofits, because we knew that we needed to fill gaps that were existing. There are so many amazing organizations that are there doing research, like Lupus Research Alliance, advocacy, but we needed that connection with the individuals. We needed that connection with families. We needed to be real. We needed to come from a space where we knew what it was to be either supporting someone that was living with lupus or having lupus. I can't imagine how your mom, dealt with all of this alone, when you were diagnosed with lupus at the age of 11. And I think it was not only scary for her, but for you. And imagine now you as an 11-year-old having all this amazing support, your mom having someone like you on Mondays to not only talk about lupus, but also inspire and empower. And, it's just amazing everything that you're doing. And we're so grateful that we are helping you along this journey because I met you through, and I say I met you because that little lens that you talk about does connect people. When I first joined that live support group with Kelli Roseta, with another organization, I guess you were with another, Molly's Fund, I think it was. And it was just amazing. And I knew that there was a connection, and I knew that I needed to feel supported because even though I don't live with lupus, I wanted to learn and know more about lupus because I was supporting my sister. So then when we got to meet you in person, it was like meeting a celebrity at Advocacy Day at the Hill. And it was just so amazing because Kelli was the same. She wasn't like a fake person, like, when she's on live camera or pretending. That was her. And so ever since we met, we connected, and I don't think you've been able to get rid of the Mata sisters since that day. And, we've been working together. We saw her start creating, More Than Lupus, and we've seen her rise up and touch so many lives. And I think that is so important. And yes, we are highlighting you, Kelli, because of all the amazing work you're doing, but also these amazing, symposiums that we're going to be holding together. I think it's needed. It was needed in the community. And what we started last year is continuing, and hope that others get to share it and also get to learn, because we need to talk about these things.
That's so beautiful and great insights from Estella. And Estella, if you have a headset lying around, we might need to try that with your audio because we had some static and I don't want people to lose out on such a beautiful message. But this is what we do when we live broadcast. We troubleshoot on the air with you. And if it gets really difficult, sometimes with StreamYard, we ask that people log off and log in, but it's okay. Well, the show must go on. And that's what's so great about all of this together. I know we would love to be together in person, but we're making it work as is. And soon enough, we'll be there in Portland with everyone. And I appreciate these conversations so much because this is what the Fibromyalgia Impact Tour is really definitely going to highlight. And we want to bring in, what do people really need to improve their quality of life, whether you're living with fibromyalgia, lupus, or other autoimmune conditions. And we need to have these conversations. And as patient-led organizations, we're right there with the patient community. And we're getting this information, and how also can we work together to make sure that the patient community is cared for properly and they're getting the resources we need. So that's why it's great to be working with all of you. I am just so thrilled, and I'm excited about your event tomorrow, which we'll share more of. I did post the link for everyone to find the Facebook event group. And if you're watching on YouTube or Twitter, you're going to have to come over. I think Kelli's going to be using StreamYard as well. But let's get into we want to showcase Kelli's work for all of you. And she has some special photos that we're going to share. So let me bring up this slide deck for you. And Kelli, if you don't mind, maybe walking us through some of this.
Yes, that was 2 years ago at our Take a Loop for Lupus awareness and fundraising walk here in Portland. It was sunny that day, which is always nice since it rains a lot here.
Oh, wait. Okay, I lost my screen. Oh my gosh, production. Okay.
Yeah, it's another shot from inside our walk. That's almost all of the group that was there that day.
And so this walk was so this was a More Than Lupus walk that you had put together, correct? In the mall.
Yes.
Okay.
Yes, it was called Take a Loop for Lupus. We made an L inside the Washington Square Mall up here in Portland. And everyone did individual fundraising campaigns. So it was awareness and fundraising and advocacy all in one. And this was during May, which is Lupus and Fibro Awareness Month.
That's fantastic. And can I just give you a shout out? You had some really cool Nike shoes that you were.
Yeah.
I have to say, for the lupus community and everyone, you have a lot of style. So I need to learn some of this fashion techniques, because those shoes were awesome. I wanted to replicate them because they were purple. And then I see Emmett with his nice purple shoes. Like, I gotta go shopping with you guys once this is all over. We don't have a picture of that though, Kelly, right?
No, but here's another little tidbit for you about Portland. Portland is the Nike capital of the world. This is where the Nike headquarters is. So a lot of people bust out the Nike swag here.
Oh, I know. The shopping is great because they have the big old Nike store in downtown, and I love going. I just miss not being able to travel. And you do a lot of speaking engagements. So here you are speaking in public and representing the lupus community.
Yes, I was a keynote speaker along with Dr. Thomas, who wrote the Lupus Encyclopedia, at the Michigan Lupus Foundation's annual symposium. So that was a highlight, I would say, of my professional career, being alongside such esteemed professionals like Dr. Thomas.
And again, fabulous looks from all of you. I know I've seen your videos also, which we need to get the links for, because you have some YouTube videos on makeup and all. I've been watching it, but I asked you to can we go backtrack and do some tutorials for the ones that are like 101, like starting out, how not to stab your eye with a mascara pen. And then we have you guys doing a lot of advocacy work.
Yes, so here we are, me and my sisters, the Mata sisters, at we were at the American College of Rheumatology National Summit on the right, or at least it appears to be on the right, with Estella and Juana there, working alongside Lupus and Allied Disease Association. And then on the left of the screen, that big group of people, that's at Advocacy Day for Lupus Research Alliance, where we go to the Hill every March, and we push for more federal funding to be allocated to lupus research, specifically for the NIH and for the lupus research program. And a little note about the lupus research program is that I had the privilege and the honor, this is the other probably biggest accomplishment of my professional career, of being chosen to be a part of the original stakeholders programmatic panel that initiated the lupus research program 4 years ago now, which has since become a driving force of lupus research, where the Department of Defense funnels federal dollars specifically for lupus research.
That is incredible, all the work that you're doing. Is there going to be a March event for lupus virtually this year?
Yes, there will be through Lupus Research Alliance, and I know Estella is involved with the training, as am I. It's gone virtual, but you will have an opportunity to log on and be trained on how to have video conferences and leave phone messages and write emails to your state and national representatives about how it is important to share your story and how it is important to continue to press for more lupus funding to be dedicated to, federal funding to be dedicated to lupus research. That's what I meant to say. There we go.
I am just inspired. I know I've seen everyone's work, and you guys are posting photos from there. At one year, you also had purple capes that you were walking around Capitol Hill with. It was just very inspiring for all of us in the fibromyalgia community. I'm so glad, again, that we're working together to encourage each other to find our best selves when it comes to being a health advocate. So I appreciate this quite a bit, Kelli. You are definitely making an impact out there in the community.
Thank you.
We definitely have something exciting here for all of you. First, let's check in with everyone on these comments. So we're going to say hello to Lupus Spoons. Let's just say hello, Lupus Spoons. Hello from Chicago. We have Emmett tuning in from San Diego. Here, definitely, if you want more information, we put the More Than Lupus website. You have an updated website, which I was excited to see. Great work there.
Thank you.
You have your loopy sister right here too. And then we have Terry. Terry, where are you tuning in from? So be sure, everyone, to let us know where you're tuning in from as we say our hellos. Thank you to Robin. Powerful group of ladies. I agree. These are our superheroes from the community. Everybody loves hearing from you. So this is definitely good. Oh, there's Crystal. Good morning, Crystal. We're rocking it. Yes. Good morning, everyone. And Karen. Welcome, Karen. I know where Karen lives. So I'm hoping Karen joined us in the first advocacy day over there. Oh, Terry's in California. Hello. So close.
Yes, we know Terry. Hi, Terry.
Abigail from Maryland. Robin from Chicago. We have a lot of people tuning in from Chicago. Thank you, everyone, for tuning in this morning. We are excited. Oh, look at that. West Covina. You're our neighbors over here in California. We got SoCal represented. And, of course, Karen, North Carolina. We have to do more stuff. I think next March 12th, we're going to be in South Carolina with Crowning for Lupus. So that's going to be fun. So we're touring the country, and I don't know what we're going to do in between as we go over there. But I'm glad that we have Kelli here with us. So let's talk about this. Oh, Kathy's from Portland. Hello, Kathy.
Yeah. I know Kathy.
Yay. Let's talk about this giveaway here. So what's the question that Estella came up with that we can do a giveaway? And then we'll have Kelli share what these giveaways are all about.
Perfect. Look, we have more people from LA. Okay, so if you guys have been listening to Kelli and to a couple of things that I've said about Kelli and brought up, Kelli has been living with diagnosis for a long time. And do you guys know when Kelli Roseta was diagnosed with lupus? At what young age? I'll give you that clue. Young age did she get diagnosed with lupus? Because I know where she's young right now, still looking young, but at what age was she diagnosed with lupus?
Oh.
Oh, everybody knows.
Oh, you got the answers. Oh goodness. Who was the first one? Kathy? Kathy at 11. Look, everyone knows. Everyone was paying attention. I love this. 11.
Look at this.
Yes. So, Kelli, do you want
People
to
do listen to me.
Yes. We've been listening to you for a long time.
Wow.
Kelli, so whoever won, let's see, Kathy, what did Kathy win?
She won a copy of my special butterfly. I have the Spanish version here, Mi Mariposa Especial. And this is a book that was written for you to have a conversation with the little loved ones in your life if you're living with lupus or lupus overlap illness. And it's something that I felt was needed in the community, particularly to have a book that represents communities of color and to be inclusive and to really break down commonly asked questions. There's a parent guide in the back too. It works great for grandparents, aunties, godparents as well, of how to most effectively answer those questions in a way to the little loved ones in your life, in a way that's not scary, it's not too much information, not overwhelming, but really gives it to them straight in a loving way because they have really big feelings and really big imaginations. And oftentimes they imagine the worst, and there are ways for you to be truthful when you're talking about your chronic illness. And this is the guide to help you do that.
Yes, and here's the English version, because you know what? We have both.
We have both. So you can choose. You can choose. The illustrations are by Hannah Lou. She did such a great job for me. It does focus on the butterfly rush, but it also talks about fatigue and body aches and other symptoms that can come up. And even if you don't maybe necessarily have the lupus rash as your most troublesome lupus symptom, you can also apply it to talk about other things that you're going with right now during a lupus flare. So congratulations. Yay!
Yes, so congratulations, Kathy, are the grand prize winner. Although we might have to talk to Kelli about some of this, because the people that posted, I know Support Fibro with this Impact Tour would like to add some more books. So if you got in there, just please send us your mailing address so we can properly get you copies of the book, and let us know whether you want the English or the Spanish version. See, we were just cranking out these giveaways today.
Yes, and if you can let them know, for those that want the book that did not win because they didn't respond fast enough, where can they find the book?
Yes, so the book is available on Amazon and smile.amazon.com. The great thing about smile.amazon.com is that a portion of most proceeds goes back to More Than Lupus if you choose that as your charity of choice. If not, you can choose Looms for Lupus or Support Fibro. Wherever it goes to any of these organizations, it'll be well used. And it also is available on, like Melissa said, our newly improved More Than Lupus website. So that's www.morethanlupus.com, not .org, it's .com. And you go under shop and you'll see it there.
That's fantastic. Oh, and I love this comment right here. So yes, please don't forget when you purchase the book from Amazon to kindly leave Kelli a review. It helps all the authors out there. So let them know that you love the book and leave a review on Amazon to help promote Kelli and get more copies of her book into the hands of other chronic illness community patients. We always have to plug the reviews.
Yeah, thank you.
Well, now we've switched gears. So we had the giveaway, and wow, the responses were quick. I love it. But we're in Portland, so we got to talk a little bit about being on the road and in Portland. I wore my Hillsboro Hops T-shirt just for it.
Yay!
We love supporting everything.
What's Hillsboro?
Hillsboro is a suburb of Portland.
Oh.
So not too far from me.
And they have the baseball. So Michael and I go watch the baseball games whenever we're in there. I love the transportation because it can take us right over there to the stadium. We took a little bus over to see the Hillsboro Hops games. We enjoy all the things that Portland brings us. And I mean, I can't leave without asking about Voodoo Donuts and some of the food. But are there other things to see in Portland? Can you let us know what would be, if we're visiting Portland, what would be the best things to see and to eat? I'm so focused on food, but maybe not everyone is.
Well, the donut scene has gotten a little bit competitive here. Used to be Voodoo was like the thing that was known about Portland, but now we have Blue Star and all sorts of other donut that are trying to knock Voodoo off the top shelf here. But I will say, I still think that there's really something so authentic and real about an original maple bacon donut from Voodoo. There's just nothing like it. And the cool thing about Portland is that every little section of it is different. It's unique. I live kind of out in the burbs, very close to a lot of wineries. I've got wineries 5 minutes from my house. And I think that's really cool because everything is very close. I mean, I grew up in Southern California where, you would drive an hour or a couple hours in traffic to get somewhere. Everything's very close in proximity here. You can drive an hour and be in the snow or be at the coast or, be off the grid in nature. Everything's really close. And there's lots of places to hike. There's lots of places to eat and really fun, interesting food here. And of course, we are known for our microbreweries too. So that's fun. Lots of fun things to eat and explore here in P-Town.
Oh, I know. Well, I mean, just a funny story with the Hillsborough hops because of the craft beer thing. But I attended Barley's birthday at the game. He happened to be celebrating his birthday, so we had cake at the game, along with a showcase of some of the craft breweries. So it's a fun place to visit if anyone. And I do like that accessibility. I always talk about this when it comes to public transportation. I didn't realize that you grew up in Southern California. So, you know, sometimes even though we have public transportation, it's still a hike to get to major venues, and especially Los Angeles County. But it was fun with Portland to go, and you could have dropped off right in front of the Timbers Stadium. So I got to see a Timbers game because of the accessibility of everywhere. So it's just a beautiful place to visit. Can't wait to be there in person. Kelli, what else? When you take your road trip, like what's on the radio? What are you blasting? What kind of snacks do you take with you?
Well, we go to Bend a lot, which is, in Southern Oregon. It's beautiful. And it seems like every time we go there, whether we're going for the snow or in the summertime to float down the Deschutes River, we always have either Motown or classic rock playing. Those are kind of our go-tos. A little Hotel California when we roll into town, even though we're in Oregon, we always listen to the Eagles, or some good old Stevie Wonder. That's kind of my jam.
Well, and then Looms for Lupus, you've been to Portland. Did you get to explore while you're up there? I mean, I've had the pleasure of driving all the way from California up there, so there's some great stops. I know we stopped at Rogue Creamery on our way there. Eugene was a must-stop area. We took in a game in Corvallis. So there's a lot of places to see, but I'm curious what Estella and Juana were up to when they went to Portland.
We actually, it's so funny because we didn't, all the time that we traveled with these in 2019 and a little bit of 2020, it was all work related. I wish we would have had a lot more fun and time to explore and learn about all the beautiful places to visit over there. Someone was talking about waterfalls and stuff. We went in specifically to, I've been there twice, I think. Yeah, twice. One for the pain symposium, chronic pain symposium, with Kelli to support Kelli. And then the other time that I went was just briefly, just to,
It was last year.
Yeah, it was last.
No, it was last year for the How Lupus.
Oh, this
American. Yes, exactly, okay. A year ago.
There's my fibro fog. It was a year ago, so I've been there twice already for the pain symposium, and then also for the symposium that we're going to be having virtually this Saturday. So yes, I've been there twice, but again, we have not had the opportunity to explore too much. But as long as we were able to see Kelli, our friend Kelli, and our friend Molly, and continue to do the work with them, I think was already a gift for us to be able to be there. But going to the road trip stuff, I would like to actually drive out and do all these pit stops with you, Melissa, that you're talking about. You got me a creamery. And then Kelli, I'm with you. The Eagles in Hotel California is probably one of my husband's and my family's favorite songs. No matter where we're going, that's always playing. So, I'm with you with that. And can we talk about chocolate though? Because both of you, Melissa and Kelli, can name like See's Candies chocolates. I will eat them. I don't know the names, but I will eat them. I enjoy them. I love them. And you both had a fundraising event with See's Candy. And by the way, we are not being paid by See's Candy. We just love See's Candy. If we pay them. We pay them. But if they're listening, maybe perhaps start, see what you can do for us, for the lupus community and fibromyalgia community.
Well, it's kind of funny because Melissa started it because I saw that she was doing the See's fundraiser, and then I think Estella, you tagged me in it because about my deep love for See's chocolates. And so then I talked to Melissa. Melissa's like, you should do that for More Than Lupus. I'm like, heck yeah, I should. And so I did, like, the next day. And oh my gosh, I sold like, I don't know, $800 worth of chocolate or something. But the interesting thing was finding out how many people were unaware of the amazingness, which is See's chocolate, because like in Chicago, like Robin's here, they don't have it. It's so only certain states have See's candies. So I feel like it's my duty to share this with the world.
Oh, yes. I did not know that. So we are privileged, I guess, to have all these amazing chocolates. But someone just posted that they have chocolate to send to Kelli from Chicago. So Lupus.
Yes.
And
So Mari and I have a little rivalry going on where she said we have the world's best or world's finest chocolate, the big chocolate in Chicago. So she said that's her go-to, and I said, well, mine is See's. And so we kind of have this like healthy competition about whose chocolate is better.
But look at this. I love this. Your mom is on. So hi, Patty. And she says that your addiction started as a child. I love it. You know, I love that your mom supports you. She's like our mom. She's always on, tuned in. Even though my mom doesn't speak English and we do a lot of stuff in English, she'll still tune in. But I love that your mom is always on. And, you know, I'm going to drive out there for whatever cake she bakes, and I'll still send you some.
Yes. It's been also like with my mom and I, where, you know, we would go to the See's candy store and we'd get a certain amount of each one. But then I'd be like, hey, we count them and make sure that, you know, we weren't, that someone else wasn't eating ours. I'd be like, how many have you had? Okay, I've had 4 butterscotch squares. Well, I've only had 3, so I'm owed 1 more. Like, we would always be so funny about our See's.
Well, I think I found my childhood. We would have been like best friends as children, Kelli, because my mom was we are See's candy family. So if you ever have gone to City of Industry where they have, but she knew someone that works, and I guess what they do is they sell for discounted the imperfect chocolates, which come in a big, huge box. I think I have a picture somewhere on social media as I throw away my health coaching career right now to just talk about all the food, especially the food on the road, because even in Portland, there's this special place that it has churros with chocolate dipping sauces somewhere that I found. Everybody knows, and you'll hear from Brandy that I don't know how I can sniff out these places. They're not the healthy places to be eating, but they're the local spots. So See's candy all around. I think we have to get a sprinter so we can tour, and then we can have See's candy competitions in the sprinter.
We should have a name off where during a stream we will show the other person, give them 3 seconds and show them the chocolate and then take it away. And then you have to know what it is to win a point.
Oh, you need to get sponsored here. See's candy. Yes. Are you listening? I just got a call from my rep. I need to tell her about this video. So California Brittle, here we come. Scotch Mellows.
Yeah. Let me tell you, Juana is very quiet, but she's a chocoholic.
Oh, yes.
She is a chocoholic.
And I can say that if I go to See's Candy, City of Industry, county employees get discounts, so I get discounts. And
wait, she's been holding out on us the whole time.
So I buy a pound of See's candy. I always think, okay, I'm gonna eat it slowly, but then I think, well, calories 1 week, 3 days. Well, I'm gonna just finish it all. So I just start eating all day until I finish the pound. I'm not saying that I'm gonna finish it in 1 day, but maybe in 2 days. But yeah, definitely, I'm a chocoholic. I was introduced to See's candy at an older age because we didn't have the money. I didn't go to the mall, and my father one day brings candy because it was a gift that his employer gave him, and he introduced me to the See's candy. After that, I have to always get See's candy. I'm a chocoholic. One of my grandkids is a chocoholic, and my son is a chocoholic, so we love chocolate.
So we need help.
Yes.
This is where Melissa's going to come in and remind us that eating chocolate is maybe good for a little bit, but then she needs to bring us back onto the healthy gardening and healthy eating, because everything in balance is as well.
I don't know. You lost me with this. No, I mean,
We took you to the top.
Bring you to the dark side and the milk chocolate side.
I almost expected the Oompa Loompas to come out at this point, because we're just like dancing around. No, I mean, you guys have lost my brain into the chocolate world. And this, like I said, just thinking about our trips, my trips to Portland and driving, we would stop at Larry's Cupcakes in Eugene. I mean, Rogue Creamery. I remember off-roading. There was a lot of construction where that was. And my mom's like, where are you taking me? Because we're like moving through this area that had nothing there. And there was Rogue Creamery, and they make this amazing cheeses. So I can't say that I'm going to be the best influence on us as we do our road trips, but it's exciting. We have all this information. I'm sure everyone out there knows that we can talk forever on chocolate, but I love hearing these stories and how we love our family life with these candies and other chocolates and food. If we can, let's go back to your event. So I'm going to go back to our lovely slide deck, and I want you to talk about, let me find our deck. Let's talk about the events that are coming out before we close out, because we could talk to Kelli forever. And maybe some of the stuff as we geek out on it, we're going to go try some chocolate, each of us, after this. But you have some events coming up that I want to share with everyone.
Yeah, so this is happening tomorrow. This is happening tomorrow at 3 p.m. Pacific Standard Time, which is 6 p.m. Eastern. And like I mentioned earlier, it's going to spotlight 3 amazing community leaders and the work that they have been doing in the minority communities. And we're going to have our board member, Anita Noble Love, be our moderator for tomorrow's event. It'll be on the More Than Lupus Facebook page, brought to you by StreamYard. And yeah, so we're switching it up a little bit this time. Last year, the events that we did that are sponsored by GSK in collaboration with Looms for Lupus, they were, presenter 1, presenter 2, presenter 3, and then question and answers. Well, we wanted to, because everybody's getting a little bit tired of Zoom fatigue and all these different things of the virtual events, we really wanted to mix it up. So tomorrow what you're going to see is our moderator, Anita, ask a question of the first speaker and then ask a question of the second and a third. So you're going to see a lot of different people speaking throughout and having questions asked throughout to kind of bump up engagement and keep it fresh.
Well, your events have been super informative. I mean, I love tuning in, and I learned so much. And then everyone posts their questions and we share comments. So it's very engaging. And I'm going to share the Facebook event link again for everyone. But I definitely look forward to tomorrow.
Yes, we're very excited about it. And just continuing this plan of action to highlight underrepresented communities that have lupus and other autoimmune conditions that are communities of color.
Yes,
and I know there's other events going on this weekend that you're a part of with Looms for Lupus, the Lupus Project, correct? Is that?
There is, yes, the Lupus Project is ongoing for a couple of days. So it started yesterday. It's going through all the way to Sunday. And Looms for Lupus is going to be there tomorrow, Saturday at 12 noon. So we will be sharing this information for those of you that have not registered for that. This information is going to be shared there because I think, at the end of the day, we have to continue to highlight these things. And not everyone is highlighting the effects of lupus in the different minority communities. And I think this is why it's so important. Remember we were talking about filling the gaps and knowing where, what we need to do. And with Kelli, that's one of the amazing things that we have learned is, how can we help fill this gap? And, this is not just something that needs to be talked about in the month of February. we need to talk about this throughout the year. And this is why this is going to be ongoing for every year. It's going to be an annual symposium because we need to highlight these all these underrepresented communities, the African American communities, the Hispanic Latinx communities, the Asian Pacific Islander communities. Lupus affects us, our minorities, and we need to highlight that and learn and educate each other. So this is why this is so important. So tomorrow at 3:00 p.m., we will be live on More Than Lupus Facebook page. Please join us, because I think the more that join and the more that you share, the better it's going to be for everyone overall, because we need people to not just learn about what lupus is, but learn how it impacts our different communities. But
Right.
on another note, what I was going to say is, if anyone wants more information in regards to this, they can go to our Facebook pages, and also send us questions, direct messages, if you want to learn more about this. And we're here for you. We're here to support, like I said, Kelli, we're here to support our community. So we're looking forward to everyone tuning in tomorrow at 3 p.m.
Well, and it was interesting to see that article that I shared with Juana and Estella about the prevalence in the communities with that, and how the severity is so much higher in these communities. So it's definitely important we address that. So we posted the Facebook info in the chat. So we'll be sure to pin the comment so everyone can tune in. And I'm sure when we log off, Kelli will post more information on how to get directly to it'll be streamed on the More Than Lupus Facebook page for everyone to tune in.
Yeah, and it's been really, really cool that we're the first to do something like this. We are patient-driven, patient-focused communities, and we came together with a mission. And like we said during our Amp Up symposium, which wasn't that long ago, that you were part of too, Melissa, was to whom much is given, much is required. We have been given these opportunities for these platforms, and we have also have these diseases, whether it's fibromyalgia or lupus or something else, that we live with, and we know where the needs are. And it would be negligent of us as patient-driven, patient-focused communities not to go there. So we came together, and it was kind of a fun little, we all came together one night. We were at, was it ACR?
Yes, ACR 2019.
ACR. We were at the American College of Rheumatology. We were all exhausted because we had a long day of sessions and volunteering and meetings and everything. And we were like, we've got to do something about this. And so we came together and we formed this plan of action to highlight through unique symposiums the problems with enrolling people of color in clinical trials, medical biases, all these different things, and how we would do them and what it would look like. And we didn't know if it was all going to come together, but we just put all of our blood, sweat, and tears into these. And it has been a plan of action that has continued to evolve. And I'm so thankful to have Estella and Juana by my side to do this with.
Well, we are here to support you in any way that we can. And it took 3 months actually to get the first symposium up, and it was in person, and it was, I think, a success. We learned so much that one day, and we know that this is important. That's why we will continue to support. Mm-hmm. And you're right, Kelli, not everybody is doing this, and it's sad. And a lot of people are always telling me, why are you doing so much? Why can't you just stick to one thing? We are here because we need to amplify our voices, and we need to unite with others that think alike and those that don't think alike. And we will give and provide the information and share as much as we can. And we don't do it because we want any accolades. We don't want any of that. We just want to share information. And we know that this is needed, and that's why we are doing it. And yes, we huddled together, and we were, if you remember that day, I was a little nervous because, sometimes you don't know how people are going to react to a lot of the actions or what you plan on doing, but but you can't think of what others are going to think. You have to know that what you're doing is the right thing, and then just continue to do that, and know your worth, and know your path, and know that you can make a difference. So thank you again for including us, Kelli.
And do you remember what I kept saying to you every time that we'd talk through our fears, our anxieties? I would always say to Estella, the time is always right to do what is right. The time is always right to do what is right. You know, when the pandemic hit and, you know, all these different things were happening, we weren't sure if we were going to be able to meet or what it would look like. And there's different organizations involved. And, you know, we're being pulled in every other direction with different things we're working on. You know, every time when it got to the point where we're like, what are we going to do? We just kept saying that the time is always right to do what is right. And it's important work. It's needed work. It's also extremely important to identify and shine a light on the work that has been done through community leaders in this area. And that's exactly what we're going to do tomorrow.
I love it. And I love that message. We need that on a t-shirt and plastered all over social media. It's so great. So everyone out there, thank you for tuning in. We loved visiting with Kelli today. As you can see, I hope you got inspired by her impact in the community. We have so more interviews and coming up, and you definitely will be inspired as we continue on the road. Just to quickly close out, I know Estella and Juana have some events. Do you want to quickly share these coming up on Sunday for Rare Disease Day?
Yes. So this Sunday is Rare Disease Day, and not a lot of people know, but Juana does live with a rare condition. It is thrombocytopenia, and it involves your blood, and that's how she was first diagnosed with lupus, because she had very low platelet count. And a lot of people do have a lot of overlapping conditions. So on Sunday, we are going to be with our friends David Ross and Chelsea Strite on Twitter. And we're going to be highlighting and shining the light also on rare disease and mental health, because mental health is as important as physical health. And one thing that we have been talking about is that regardless of what you're going through, regardless of your condition, whether it's a rare disease or a chronic or autoimmune, you have to make sure that you remind yourself that mental health is very important, and we need to shine the light on that. So that's going to be on Sunday at 10 a.m. Pacific Standard Time. So you could just join the chat. And then also on Sunday, we are going to be teaming up with our friends, the Lupus Chat team. And we are going to be talking about legislative partnerships and health advocacy, which is something that Kelli and you know, my sister and I do and love to do, because we cannot you know, stop from amplifying the patient's voice, sharing our stories, and making change and making a difference in future health policies, and making the difference in our healthcare and how research gets funded and all of that. So those two Twitter chats are going to be on Sunday, 10 a.m., and then the other one at 12 p.m. Pacific Standard Time. So I hope you guys can join us.
Fantastic. It has been fun, and I know people have enjoyed. So Anita is excited about tomorrow.
Yes.
We're stronger together. I love it. Emmett, thank you so much. Another inspiring advocate from the community. Robin, thank you for tuning in. I'm glad you enjoyed. We definitely have to do this again. I'm excited for our work in May. So we're going to rock it with May and turn everything purple. And if we don't get chocolate brains,
we will turn purple. So we'll make sure we have our chocolate.
Oh, Karen, thank you for tuning in. Thank you, Kathy. Be sure to send us the mailing address and anyone else that won, so we can get you copies of that beautiful book. I'm so excited for Kelli and all her work. Thank you again, Kelli, for joining us. So we will see everyone on the road very soon. Bye.
Bye.
Thanks for visiting.